Actually, this topic was to be covered by Dr. Vipin Ved from Amritsar, but he unfortunately he fell ill, and he requested me to deliver on his behalf. I am very thankful to Dr. Dinesh Garg and AIOS that they have given an opportunity to share something with you. Age-related macular degeneration, as you all know, it is very, very important problem nowadays. As age is advancing and the life expectancy increasing, the pattern of living pattern is changing, and it is basically very, very important condition in Western country. And as the population is catching up and higher age group is involved in India also. So, as far as this age-related macular degeneration is concerned, as we call it ARMD, age-related macular degeneration. This is, we use so many modalities before we conclude that this is ARMD and nothing else. So that is a very important thing. For that reason, we record visual acuity history of the patient. Age is near about 60 or more than 60 years of age. Senile age group is there, and we have to rule out other diseases also, as we know that diabetic retinopathy and other conditions are also which are related to retina. But this condition, for documentation as well as for the satisfaction of the patient, we have to go on. Now there are other modalities also which are also very important, and they are coming up for the diagnosis of the ARMD. But still FFA holds good for the documentation as well as for the satisfaction of the patient, and we can record that it is ARMD and nothing else. The ARMD will start as a hard drusen and or a soft drusen. Two type of drusens are there, and it will go on to intermediate type, pseudo type of drusen, and other conditions are there. But drusen will ultimately lead to degeneration in the retinal layer, and ultimately the nerve fiber layer is affected. This is a pseudo soft drusen, and very clear picture is there, red free, this picture is there, retinal picture is there, and fluorescein angiography is there, which will differentiate the drusen from pseudo drusen. Drusen merging over a time period. It will take a very, very long time as it is developing, and where patterns are developing in fluorescein angiography, as it is shown in slide A, B, C, and D. Absorbed drusen. Drusen with the passage of time, sometimes it is absorbed, but when we do fluorescein angiography in late phase, there is a hyperfluorescence and a very good pattern we can see there. Geographical atrophy. Basically, ARMD is a disease which is related to macula and perimacular areas. So it is a degenerative disease. It is a progressive, and this type of pattern may develop in some cases of this ARMD. Classic choroidal neovascularization. Here, fluorescein angiography in late stage, you will see the hyperfluorescence in stage B, and in slide A, we are having a classical picture of choroidal neovascular membrane, which can be, it will tell us that then occult CNV. It is concealed and it is hidden type of occult CNV. There is a specific red-free picture, and then early phase of fluorescein angiography, mid phase and late phase will tell us about the pattern of fluorescein angiography. Then it is again a concealed choroidal neovascular membrane, where we can see the definite pattern in fluorescein angiography in late phase. This PD with a notch. Here there is a pooling of the dye in late phase, and we can see a definite pattern again. disciform scar of this macular area, it will give us a diffuse type of fluorescence which can be recorded and documented. There are various terminology which are very well now defined, and well defined versus poorly defined. We can have this pattern and we can differentiate the well defined and poorly defined. Classic versus occult, concealed or revealed, or we can say classic pattern of fluorescein angiography in this ARMD and occult. Then minimal classical versus pseudo-dominantly classic versus occult. We can again differentiate with a fluorescein angiography pattern. Predominantly choroidal neovascular lesions and lesions versus lesion components. We all type of these terminology. We should be conversant with the terminology, and we can differentiate on fluorescein angiography pattern. Then minimal and classic choroidal neovascular membrane with a laser scar. It is having a definite pattern with scar and hyperfluorescence in slide C. Then REP, when there is a retinal pigment epithelium rip, then there is a hyperfluorescence in that area, and we can make out that diagnosis. RAP, where there is a small leash of blood vessel which will grow later on, and we have a definite, you can see a patch where on the end of a small capillary there is a pooling of the dye. Thank you so much.